severe pimples, plus clogged pores? Scrubbing harder won't fix it. Today I'll show you a barrier-safe deep cleansing routine that clears pores, deflates big zits fast, and keeps new breakouts from forming. Three to 5 minutes gentle steam or warm towel on the T-zone and jaw. Optional, add green tea or 1 drop of tea tree to the bowl for a calming antibacterial boost. Pat dry, no rubbing. Warmth softens plugs so the cleanse reaches deeper. Oil cleanse 60s on dry skin to dissolve sunscreen, makeup, oxidized oil. Emulsify, rinse. Gel foam cleanse 60s with salicylic acid, BHA, or heartleaf green tea to sweep inside pores without stripping. If skin feels tight after rinsing, your cleanser is too harsh. Blackheads, nose, chin, BHA 1–2% 2–3 xan week, dissolves oil plugs inside the pore. Texture, sensitive zones, PHA, LHA, or lactic for gentle surface polish. Rule, press, don't rub. Over-exfoliation, micro-tears, more inflammation. Mix kaolin bentonite clay with a pinch of enzyme powder, papaya, pineapple, plus green tea. Apply to congested areas 8 to 10 min, then rinse at now 80% dry before cracking. Result, detoxed pores, plus refined texture without that dehydrated, tight feel. When a large, painful pimple appears, the first instinct is often to panic. But resist the urge to pick or squeeze. Instead, we're going to deploy a calm, strategic, 3-phase emergency response to reduce its size and lifespan without causing damage. This is your SOS protocol for those angry, under-the-skin cysts that need to be managed, not attacked. Phase A is all about calming the inflammation. Take an ice compress, an ice roller, or even just an ice cube wrapped in a soft cloth or paper towel works perfectly. The key is to never apply ice directly to your skin, as this can cause damage. Gently roll or hold the wrapped compress over the inflamed area for 60 to 90 seconds. This process, called vasoconstriction, helps shrink the blood vessels, which immediately reduces that throbbing pain and visible swelling. It's a simple but powerful first step to take back control. Next is Phase B, decompress. After gently cleansing and patting the skin dry, it's time to address the congestion. We'll use a targeted leave-on treatment. Apply a thin layer of a salicylic acid or azelaic acid serum over the entire affected area, not just the peak of the pimple. Salicylic acid is oil-soluble, allowing it to penetrate into the pore and dissolve the clog, while azelaic acid is a fantastic anti-inflammatory that also helps prevent the dark mark that can be left behind. Applying it to the surrounding zone helps clear the whole local network, preventing the issue from worsening. Finally, Phase C, kill and heal. This is where we introduce our A-B path for targeted overnight treatment. Option A is benzoyl peroxide, a gold standard for killing acne bacteria. Use a low concentration, like 2.5%, as a tiny spot treatment directly on the pimple. If your skin is sensitive to benzoyl peroxide, go with option B, a sulfur-based spot treatment. Sulfur is gentler but still effective at drying out the pimple and reducing inflammation. After applying your chosen spot treatment, seal it in with a hydrocolloid patch. This little bandage is a hero. It creates a moist, protected environment that helps the spot treatment work better, and it physically stops you from picking. Overnight, it will draw fluid and pus out of the pimple, visibly flattening it by morning. The most important rule, never try to force an extraction on a deep, angry cyst. It's not ready, and forcing it will only lead to trauma, infection, and a guaranteed scar. Treat, protect, and be patient. Only after steam mask and only for ready whiteheads, blackheads. Sanitize tool or wrap fingers with tissue. Press beside, not on top. Slow rocking motion. If it doesn't glide out with light pressure, stop. Post-care. Localize salicylic swipe and ice roller 30-45s to calm. After any extractions or exfoliation, your skin is in a fragile state. The first priority is to soothe and calm it down. This isn't the time for harsh actives, it's time for healing. Reach for a hydrating toner or a calming essence. Look for ingredients like Centella asiatica, also known as cica, which is brilliant for reducing redness and inflammation. Heartleaf is another fantastic botanical that soothes irritation, while panthenol, or pro-vitamin B5, helps to hydrate and kickstart the barrier repair process. Apply it gently with your hands, patting it in to avoid any friction. Next, we rebuild and treat. This step targets lingering issues while supporting your skin barrier. If you're dealing with excess oil and congestion, a serum with 4 to 5% niacinamide is your best friend. This concentration is the sweet spot for regulating sebum and improving texture without the risk of irritation that higher percentages can sometimes cause. For persistent red marks left behind by old breakouts, or if your skin is generally sensitive and reactive, a thin layer of an azelaic acid treatment can work wonders. It's a gentle multitasker that calms inflammation and evens out skin tone. Finally, we seal and protect. This crucial last step locks in all the hydration and treatment ingredients. Choose a lightweight gel or gel cream moisturizer, especially if you're oily or acne-prone. Key ingredients to look for are hyaluronic acid for a burst of hydration and ceramides to physically rebuild and fortify your skin's protective barrier. And during the daytime, this step is non-negotiable. You must protect your vulnerable skin with sunscreen. Use a broad-spectrum SPF of 30 or higher, and make sure it's labeled non-comedogenic. This prevents UV rays from turning those red marks into stubborn dark spots and helps prevent future flare-ups. Night A, BHA, Zones, Soothing Serum, Moisturizer. Night B, Retinoid, Adapalene P-Size, Soothing Serum, Moisturizer. Night C, Recovery Night, No Strong Actives, Hydrate plus Barrier Care. Don't stack retinoid plus strong acids plus benzoyl peroxide in one night. Pillowcase 2-3x week. Wipe phone daily. Cleanse within 10-15 minutes post-workout. Keep brushes clean. Avoid heavy occlusives on T-zone. Hands off. If you want to touch it, patch it. So, what can you realistically expect? Remember, consistency is your superpower here. In the first 24 to 48 hours, you'll notice the most immediate signs of relief. That angry, persistent redness will begin to calm down, and your skin will feel less tender and reactive to the touch. This is your skin barrier thanking you for the gentle, supportive care. After about 7 to 10 days of following this routine, the textural changes become more apparent. As you gently run your fingers over your skin, you'll notice it feels significantly smoother. This is because the combination of proper cleansing and targeted exfoliation is effectively clearing out those stubborn plugs before they can form into noticeable blackheads or breakouts. By the 4-week mark, you'll see the cumulative power of this method. By consistently rotating your BHA or retinoid and using the SOS protocol for any surprise spots, you should experience a meaningful reduction in the frequency and severity of major breakouts. This isn't about perfection. It's about progress and giving you back control over your skin's health. Be patient with yourself and celebrate these small victories along the way.
If you're ready to give this a try, drop an emoji in the comments below so we can all cheer you on. I want to help you personalize this, so comment with your skin type, oily, combination, or dry, and the area that gives you the most trouble, like your nose, chin, or jawline. I'll be picking comments and pinning a tailored mini routine just for you. Your engagement truly helps this channel grow, so please like this video if you found it helpful, share it with someone who might need it, and subscribe for more barrier-safe acne solutions that deliver real, lasting results.